Good afternoon, YouTube. My name is Anthony Wallace, and I am from PCDI Healthcare and Consultants. I'm a traditional naturopath, from Cedar Hill, Texas, and I am on video today to give you a little information about naturopathic assessment and treatment. In this particular video, I will not give the whole treatment plan because every naturopath or physician has his own treatment plan that it treats its patients with. So I will give you just a sample of what is used to treat patients naturally. Um, the five principles or the care plan that we use, and this is also for the naturopath students that are actually going to get their license. The first one, according to my standards, is to determine disease, is determination of disease. This is the first factor in the patient assessment and diagnosis. Most naturopath or most city says that naturopaths can't diagnose, but how you going to be able to tell the patient that something is wrong if you don't put signs and symptoms together and diagnose the patient? According to traditional naturopathy, we use air, wind, and water to heal our patients, or to not per se heal, but to treat them to where nature actually, we assist nature in healing the patient. And that's for all physicians. That's the basics of your knowledge, including the science and everything too. Um, Again, it is determination of disease. This is the first factor in the patient assessment and diagnosis. The naturopath uses signs and symptoms. Signs is actually what you see. It could be the patient coming in slumped over. It can be the patient has marks or sores on them. Symptoms is actually what you hear when the patient says, well, um, I've been coughing for over 2 to 3 weeks. I've been feeling pain here in my legs, that type of situation. The patient, you have to, like I say, determine the diagnosis or the point of termination, which is the signs and symptoms of disease. The most diagnostic tool that most conventional doctors will use is a lab workup, such as a CBC, complete blood count, or a metabolic panel, which gives the physician a snapshot of what's going on in your body. We use in naturopathy or natural medicine dry blood analysis. Is where you take blood from a patient and then you put it on a slide and you let it dry, and then you look at the disease material on the slide to detect if the patient has staph or if the patient has any other types of disease growing in their body. This can be reliable. Also, in some way, depends on how the naturopath does it. There's also dry hair analysis that you use to put it in solutions to determine how much carbon is in the body and how it can affect the patient, how it can, produce disease. We also use ironology. Ironology is the study of the eye. It is a good detector. Most say it's not, and in some cases it may not be as advanced diseases. As a naturopath, I do not cut any conventional doctors because I believe that they are set here for a reason, just as we are set here for a reason. So if it becomes too advanced, great, or the disease, excuse me, has progressed to where herbs and vitamins cannot effectively treat it, you have to refer the patient out to a conventional doctor, which is more like a MD or a DO. In some cases, an ND can be the primary care physician, but NDs can only write for certain drugs. MDs and DOs can write for more powerful drugs than what a naturopath can write for. It is the study of the eyeball and also the sclera. The sclera is actually the white part of the eye versus the eyeball. I will give you a few examples of what we look for in patients that are suffering from diseases when we're trying to diagnose or piece the whole pie together. Um, I'm just looking at my notes here. The first one is the canthus. This is part of the canthus. This is your tear duct, but also is part of your canthus also. Um, they are really referred to as the heart of the eye. When we look at it, if it is red, according to naturopathy, if it's red, there could be slow circulations. It can be that the patient has high salt in their diets, or they could be dehydrated. The way how you can fix this is by giving the patient electrolyte enhanced water and vitamin therapy for a couple weeks, maybe to a month, and then you will assess again to see. If it is pale, it can mean that the patient has low oxygen saturations. This could be fixed by giving the patient vitamin O. Usually the standard dose is 16 to 20 drops twice a day. It tastes very nasty, but it is very good for you. And it comes in a solution over the counter. It can also mean poor kidney functions, excuse me, and retention of water. The retention of water or swelling in the legs and in the feet and in the eyelids, puffy eyes, can be fixed by garlic and parsley peels. Um, if the patient is on coagulation therapy, such as aspirin therapy or Coumadin, warfarin, or Lovenox injections, then you will fix this by cutting out the naturopath will cut out the garlic because it produces bleeding also. Um, and just give the parsley pills just by itself. Parsley is a natural diuretic. Okay. The next part that we will go to is the pupil. The pupil we assess for color and glance, a glare. If it is dingy, which is the pupil, if it is dingy, um, my recommendation is assess the patient for their diet. Consult the metabolic diet, which is more like your greens, your vegetables. Um, Stay away from a lot of red meats. If you do use chicken or fish, fish is only 3 times out of the week, because if you eat it more than that, you are most likely to have signs and symptoms of mercury poisoning. So again, please make sure that you are looking at the diet very closely. Assess for retention of fluids in the ankles and in the fingers. So again, that swelling in the feet and in the hands and in the eyes, you need to see a primary care physician other than the naturopath, or if the naturopath is actually the primary care physician, which is also referred to as the PCP. The patient may be given conventional drugs such as Lasix or HCTZ, hydrochlorothiazide, or naturally they may be given parsley pills over the counter um, to relieve it, because it could be either a buildup of uric acid in the blood, or that could cause such a swelling, or most people say I got the gout. So that's what can happen there. Or there could be some type of renal disruption, or what we call water disruption, that actually is what they call in conventional medication end-stage renal disease. So that person would need to see a conventional doctor. Assess for kidney failure. If it is yellow, assess for liver failure. Uh, if the sclera is yellow, that means it's severe. So they do not even need to see you anymore. They need to go to a physician. I know I keep saying go to the physician over and over, because there's only so much that we can do as naturopaths, treating from the air and the air, water, and nutrition. But they have the power to write scripts for chelation therapy or any other type of therapy that we cannot by law. A naturopath by law can't write scripts unless you are in you have went through the naturopathic medical you're a conventional naturopath. That's when you can write scripts, but you can only write for so far. You can't write over a specific schedule, and that may be too complicated, so I'm not going to get into it. But if the pupil is more dingy or dingy yellow, most likely the naturopath can handle that by giving milk thistle 100 to 300 milligram tabs 3 times a day with meals. You do not take milk thistle on an empty stomach. It will cause gastric irritation. So again, please make sure anytime that you're looking at the videos, make sure that you are going to a conventional or a traditional naturopath in your area, because again the treatment plans could be different than mine, but these are most the standard that I would use if treating patients. Usually milk thistle, the treatment is over 7 weeks, and usually the enzymes will reduce over a period of time. So that's why I say 7 weeks instead of a couple weeks, like 1 to 2 weeks, because that doesn't give the herb time enough to work. Usually herbs, it takes about a couple weeks to even see any benefit to it. Some herbs that are more potent as far as the roots, you can see much faster than milk thistle, which is more like the stem and the leaves. Assess the skin turgor, which is like squeezing your skin to ensure that that the patient is hydrated. Also, I did forget to go over the blood studies with you. This goes in the same instance with the skin turgor. When assessing patients, you look at the palm of the hand. Most likely the naturopath is going to squeeze each finger about 1 to 2 seconds apart. This assesses for blood flow. Also, it looks for proper kidney function in the nail bed, and also it looks for dehydration. So he might go through, or she might assess by the I call it the 5-point assessment. So as you're squeezing, you're also looking for blood return into the capillaries. Okay, also they're looking for, if the blood capillaries are not filling, it could be blood circulation problems, what they call circulation disorders. You treat this by cayenne pepper. Also, the naturopath will use points of pressure, which could be right here at the radial artery. And what they will do is they will put the 4 fingers, not this one, because this thumb has its own pulse. So it's the 4 fingers, or usually the 3, depends on how big the naturopath's fingers are or how they assess their patients. So you apply light pressure and you feel the flow of the blood. If the blood is flowing good, with no disruptions or no arrhythmias, then we call that good blood flow, a good return in chi. If it begins to have more of a arrhythmia, every few beats or every few bits of the flow, then we call that moderate chi, and that could be corrected also. A bad chi or distorted chi is when there is multiple arrhythmias. There's absenteeism of the heart rate, where, for example, it's going, instead of going lub dub, it's going lub 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 dub lub dub lub 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 dub. So in other words, it's beating off. It's not having a steady beat to it. And again, that could be corrected too. But the naturopath will also need to refer you to a heart specialist just to make sure that that his or her formularities are working. Because as in naturalism, the symptoms get worse before they get better. So again, if you are going to the naturopath for a flu the flu symptoms will get worse, and then all of a sudden they'll turn better. You'll feel a whole lot better, but finish the treatment as prescribed by the naturopath. Now getting back to the mouth, a lot of disease can be detected by the mouth. The color of the insides of the mouth can detect if you are getting enough oxygen or not. Usually in African American or people of color, it turns very pale and gray. So, and in Anglo-Saxons or people of lighter color, it turns white. So, you can fix this again by vitamin O, 16 to 20 drops, at least twice a day. But again, check with the naturopath, okay, or the physician that you're under. Uh, it can also mean poor perfusion of blood. So more tests will need to be run um, in order to detect which one it is. Medicine is a detective type work, so leave the detective work to the professionals. The smell of the breath can also mean determination of disease. Really, really foul breath can mean there could be gum or gingivitis, periodontal disease, excuse me, or it can mean that the bowel is disrupted, and or you're not eliminating enough stool. So this is a medical seminar. So again, uh, you will need to get that fixed by the naturopath maybe giving you um, a nutritional prescription. Fibers could be bulk and soluble. The difference between the fibers is bulk it builds up the stools to where you won't have so much gas. It won't um, cause what they call diverticulitis or any other type of stomach intestinal disease. They will also maybe give you licorice root or gingers to eliminate stool. Um, Soluble fiber is more like your Metamucil, cream of wheat, stuff like that. Uh, Getting to the lungs, the naturopath would need to do 3 assessments. This is what I call, again, 3 assessments. On the left and the right hand side, the right bronchial is longer than the left. Don't explain to me why, but it's longer than the left. By palpation underneath the breastbone here, uh, when the patient breathes, they will breathe actually a short breath and then a relaxing breath as if every day, without even pretty much paying attention to it, and then a deep breath. This assess for disruptions in the patient ability to inhale and exhale, which is one cycle of respiration. Auscultate. You need to auscultate on both sides and also hear the lungs for disruptions. Again, it could be rails, wet sounds, or absent sounds of or decrepitous. Um, you will need more practice in order to be able to perfect this auscultation skill, because some people may interpret it as different than what you may interpret it to be. Whereas I assess the patient, I may suspect wet sounds in the lower lobes of the lungs and could say pneumonia, where you may say, hey, it's decrepitous. It could be, well, decrepitous is, usually if it's traumatic or usually, um, I'm trying to get my words together. It could be that trauma, or it could be tension pneumo, that you can start to hear different things down into the lower lungs or even in the upper lungs. So again, infections. Again, that's what I'm trying to say. The cause of disease could be, again, lung tissue, uh, genetic disorders, or secondary diseases such as pneumonia from something. The feet we assess the feet for color of the toenail bed. This is very, very important because as you walk on your feet, there's different fluids that are actually going into the body. Anytime that you use a muscle or a joint, fluid is dispersed throughout the body. So we look at the feet for the density of blood flow. We look also for fluid retention and swelling. We also look for pulse pressure in the foot and also in the back of the popliteal or the kneecap, okay, the popliteal artery. This is very essential for chi, which chi is actually spelled Qi. Um, it is the energy source of your body. And most people that have poor circulation in the legs, maybe due to chronic high blood pressure for a long period of time, or the heart is not pumping blood efficiently enough, or there could be it's many diseases that can cause it, to make the long story short. But this can again be fixed by cayenne peppers, which will actually speed up the blood flow, speed up chi, and it works. Also, we says for flexation of the and rotation of the joint. This assess for swelling. Okay. The nail bed, if it is black, it is referred to as the kidney. If it is yellow, it's referred to as the liver. And if it's white, it's referred to as hydration and vitamin deficiency. Well, I hope this kind of helps you out in your testing, and also I hope that it is educational for you. If you need more information, you may contact my website, www.pcdiwg.health.officelive.com, or my educational website, which is www.pcdiwg.webs.com. Have a terrific day.